I'm Bruna Guedes, and this is the Social Impact Conference. In this panel, we'll talk about immigration and COVID-19. The Social Impact Conference is producing series of lives with some of the most important experts in the world to raise funds for international organizations, NGOs, and social projects that are helping vulnerable populations during the COVID-19 pandemic. This live stream will be raising funds for Caritas, a Brazilian NGO supported by UNHCR that is helping thousands of refugees in Brazil. Thank you so much for anything you can donate. I'm Bruna Guedes, as I said. I'm a 19-year-old activist for gender equality and refugees. I was featured in recognized national newspaper such as El País, Folha de São Paulo, and G1 for my efforts against harassment in the schools. I'm also one of the 5 girls selected to speak at the UN Foundation annual conference. I'm the co-president of Recomeço, a social project that integrates refugees in the metropolitan area. I'm freshman majoring in social science with a concentration in public policy at Federal University of Goiás. Now I will present the speakers. Thais Imbuzero is a Brazilian journalist experienced with human rights. She's currently a fundraising officer at Paris Caritas RJ, an NGO that works with refugees in Rio, and she's acting the front line of COVID-19 response. In 2014, she started working with humanitarian journalism. Since then, she worked as a communicator for NGOs and the United Nations, as an intern, and later as a consultant. Hi, Thais, how are you?
Hi, I'm fine, you?
I'm great. Now I will present Amanda Garrett. Amanda received her bachelor's degree in political science from UC Berkeley, and she's currently a visiting scholar at the Center for European and Mediterranean Studies at New York University. She received her PhD in government from Harvard University and worked as a lecturer in government at Harvard during the 2013 and 14 academic year. Her specific research interests lie in pursuing an interdisciplinary analysis of the international political and economic dynamics affecting immigrant and minority integration. Hi, Amanda, how are you?
Great, thank you.
Thais, can you please explain how people can donate to Paris Caritas RJ?
Yes, sure. So, we are doing fundraising campaign to reduce the impact of COVID-19 on the lives of refugees that are living in Rio right now. Because most of them, they were working as autonomous, like they were, how can I say, they were selling food, or most of them were selling food or crafts on the streets of Rio, but or working as not registered but as autonomous people in Rio. So with the pandemic, they lost their jobs, and that has a huge impact. That had a huge impact in the life, in the family's lives. So we launched that campaign. So Brazilians can donate on Kikante platform, like people who have a CPF number. But those who are not Brazilian, they can donate on the link we have below, caritasrj.org.br, how to help refugees, and can make a bank transfer to our bank account. Any amount of money is like of a very important. It's very important for us.
Amazing. Um, I will. You will have 3 minutes each to give your response, and I will start the questions now. Of course, if you want to comment on her response and to yours, feel free to do so. And I will start with the questions. Many people advocate a minimal state. We are seeing the need for the government to intervene in the economy and assist not only vulnerable groups, but also the general population during the COVID-19 pandemic. How do you see the role of the governments during this health and humanitarian crisis? Also, how policies would you recommend to assist migrants and refugees during the pandemic? Amanda, can you start?
Sure. I mean, I think what we're seeing is, sort of empirical evidence, real-time empirical evidence from a number of countries that have different, levels of government intervention. And as a result, they've sort of implemented different types of policies, and they've had very different effects. I happen to live currently in a country that Qatar, so I'm based in Qatar, that has a very high level, of course, of government intervention. And what we're seeing on our end here is, how do I say this diplomatically, is a fairly poor execution, I would say, of some of the most basic elements of public health and control when it comes to monitoring, when it comes to tracing. So we haven't had a lot of good examples from our region over here. But what the crisis has definitely made very evident is it's really just laid bare the basic flaws of the system, not just the sort of international system, but how states do things. And like you said, migrants have been hit exceptionally hard in this process. And some states have been much more interventionist when it's come to dealing with the fallout as it affects particularly vulnerable populations, so migrants specifically. Some countries like Portugal, like Ireland, even Canada have taken pretty dramatic steps, in fact, to isolate these populations and to regulate their movement in a way that allows them to access social services and allows them to access public health. And for those things, those are really sort of best practices of governments that have been a little bit sort of more hands-on. Yeah, I'll pass it over to my colleague.
Okay. So yeah, I think it's a basic human right to have access to public policies on the country you are living, no matter if you are a national of it or not. So if you are a refugee, I think you have the right to benefit from public policies on the country you are living if you were accepted in the country. So in Brazil, what we have a law, the law 9474 from 1997, that recognize asylum seekers and refugees, and they can benefit from some public policies that the Brazilian government offers to Brazilians, like the unified health system and the public schools and the right, the permit to regularly work, officially not recognized, and receive aid, financial aid from the government in times of crisis, like now, like Bolsa Familia and the emergency aid in times of crisis, humanitarian crisis like the COVID-19. But the system is rigged for Brazilians as well, and that's the problem. So the refugees in Brazil, that's an issue that it's even worse, because they came to Brazil, we welcome them, they have access to our public policies, and that's a huge advance in comparing to other countries. But our system can embrace them, but as well as can support the Brazilian demand. So that's a huge problem, I think. But as well, at least we have the law that supports them. But in the practice, it doesn't work so well as it was supposed to work. So that's it.
Thank you, Amanda and Thais. The news headlines announced recently that coronavirus reached the biggest refugee camp in Bangladesh. What problems do you see that refugee camps and shelter already face, and how were these difficulties intensified by the coronavirus crisis? And Thais, if you can, I would like to hear more of your experience working in a refugee camp.
Okay. So I think that first of all, just to enlight, my experience in a refugee camp wasn't when I was working for Caritas. Was in a previous experience. Was as a freelancer journalist in Palestine. What happens, but it's quite similar. Just to enlighten a little bit more, in Brazil we don't have refugee camps. We have like shelters in Roraima, so in Boa Vista and Pacaraima cities. So we don't have refugee camps in Brazil because like we have a bill here that we don't. Civil society in Brazil don't want to Brazil to have refugee camps because we think that we can integrate the refugees to society and things like that. So we don't have, but it's quite similar because refugees in Brazil, they live in favelas, and they live in they live in urban areas, but not so how can I say, in urban areas, but more quite poor areas, and not so I don't know how to say, but not so it's like live a lot of people in a small place, and they don't have like water and sanitation and that kind of thing. And it's the same thing that I saw in either refugee camp in Bethlehem, Palestine. Like they were living, they were 5,000 people in 0.1 square meter space. So they were living like one above the other, like in buildings. So it was very, very hard for them. They have to find sustainable solutions to deal with water and sanitation. It was very hard for them, and they didn't have funding to do those things. And in the case of Israel and Palestine, they didn't have the sanitation from the Israeli side. So the Palestinian as well, they didn't have. So the UN had to support them, and international NGOs and things like that. And here in Brazil, we kind of face, because sometimes the state doesn't reach those places, and it's kind of difficult for them to, in times of coronavirus, how can we follow the instruction, the health instructions of to be apart and to follow the hygiene instructions if you live in a place that you don't have access to basic hygiene items or things like that. So it's very hard, and I think it's quite similar. Like it's not similar. I don't want to. It's kind of confusing, but it's not similar. We have a lot of differences. It's not, as I said before, it's not refugee camps that we have in Brazil, but the structure, we can find a lot of similarities between them. But yeah, in Palestine, in the refugee camp, I used to work with favelas in Rio, not with refugees. Before I went to Palestine, and I found a lot of similarities between them, exactly because of that living spaces and the habits in the places, and the solutions that you have to find to deal with the absence of the state. So it's completely different places, like on the other side of the world, and very similar problems they have to face. So I think that's it.
Amanda?
Yeah, I mean, I'll just echo the same comments. I think, like, your question sort of evokes the idea that these refugee camps are a specifically high risk location when it comes to viruses, simply because of the nature of the camps themselves. They're places that are very densely populated, overcrowded. The conditions are often very poor from a logistical perspective, from a hygiene perspective. Oftentimes you don't have enough running water, or running water really at all. Maybe no soap, no sort of sanitary conditions are questionable. Medical care can be a really big problem in these refugee camps. Oftentimes, whatever medical care there is available inside the camp is fairly basic. Doctors are coming from outside of the camp. They're certainly not set up for a sort of pandemic level medical crisis. And the camp that you mentioned in Bangladesh, which is housing about 1 million Rohingya refugees, right near Cox's Bazar, they have 1 million refugees, and they only have about 45 ICU beds available. And we know in this camp that there are a couple of dozen cases already of coronavirus. So the possibility for spread in the camp is enormous. And the ability of the medical teams to respond to it in the way that they would need to is simply not there. You have also, refugee camps that are locking themselves down, that are sort of closing themselves off. This is the case in Greece, in the Moria camp. And you lock yourself off as a refugee camp, which is very dependent on the outside, very dependent on doctors coming in, on charitable organizations donating aid or food or other kinds of assistance. And you make it difficult for those organizations to access the camp. And that is another source of problems. It's true, of course, that not every refugee lives in a refugee camp. The case of Brazil, which I've just now learned about, seems to be one of those cases. Turkey, for example, 90% of the Syrian refugees there don't live in a refugee camp. They live in in urban centers. But these same problems of overcrowding, of maybe lack of access to proper hygiene, to social distancing. It's simply not conducive to those things. And access to medical care is going to be very dependent on the country in which you live, whether you're going to have access to it easily or whether you're going to be sort of excluded from health services at all. So it's a very, very dangerous place to be in terms of spread of a disease like this.
Great. Thank you, Amanda and Thais. Women and men face different problems, and when refugees, these different issues are also present. Which of these issues would you highlight? Now I ask you to discuss refugee issues through the gender lens.
Sorry, the question was for me or Thais?
For both of you.
Okay.
If you can.
Sure, I'll start. I think that this question of gender is hugely important. I mean, we know that when it comes to crisis situations, women suffer disproportionately. Women and children suffer disproportionately in crises because oftentimes it's sort of pre-existing power structures. Being a migrant, being an asylum seeker, a refugee, and being a woman puts you at a very distinct disadvantage, a distinct set of burdens. And I think probably some of the most important arenas in which you're going to find this inequality really becoming important in the context of COVID has to do with the labor or the work that women tend to do. And of course, this is not exclusive to the case of migrants or to refugees, but certainly affects them disproportionately. The fact that women and immigrant women, migrant women tend to work they tend to be primary carers. They tend to care for the sick, for the elderly, for children, both at home, but also, in the professional world as nurses, as home health aides, as doctors. They're on the front lines when it comes to being exposed to these kinds of diseases. And, we have examples of the Ebola crisis where 2/3 of the people that caught it were women, and that's because they were the ones most exposed by virtue of the caring for the sick that they did. Now, getting sick also oftentimes comes with stigma. So being excluded from your community or having difficulty accessing health services. So, the consequence of that, of course, is that women are going to be disproportionately affected by that. Women also work oftentimes in not only in these sort of frontline jobs, but also in precarious, industries that are low wage, maybe even in sort of the shadow economy or the informal economy. And so when you have a context like this, where you're seeing mass layoffs and mass unemployment, women are going to be very hard hit by that, to the extent then that migrant women in particular, are not able to care for their families. They're not able to build for themselves social safety nets. They lack that sort of economic stability. That's, a huge cause for inequality, a huge cause for concern.
Yes, absolutely. Thais?
So I completely agree with everything that Amanda said. Actually, I want to bring some data. Actually, last week, UNHCR released a report with numbers of refuge and asylum seekers in the world. And 50% of refugees in the world in 2019 were women and children. Women and girls, actually. And I think that's a huge alarm for us to see that it's important to keep in mind that we as women, we are also suffering persecution and violation of human rights everywhere. And that's alarming and that's dangerous, and we have to fight that. And some of the reasons that some women are leaving their countries is sexual abuse. So we have to also keep that in mind and fight that. And also here, it's not something that it's only for refugees, but it's something that studies are showing us that during this, like as our life is about COVID-19 and the current quarantine and everything, during the quarantine, the cases of sexual abuse, they are increasing as the women are staying at home with their aggressors. So it's something that is concerning. Last week was the World Refugee Day, and we at Caritas, we promoted a series of events online. And we promoted a webinar about refugees, women and refuge, and refugees and things like that. And we have a speech of Gambian refugee that is living here in Brazil, and she had a very it touched me a lot of her speech, because she said something about being a Black woman in Brazil, and something that I would like to share with you, because it's something that it's about not only being a woman, a woman refugee in Brazil, but also being a Black woman refugee in Brazil. She said that it was so weird for her when she arrived here, and she felt the dehumanization of her body and her skin, and the jokes and the invisibilization of everything. And she said that we have to build public policies to put on the agenda the Black lives of the woman Black lives. So I think that it's not my place to talk about it, but I think I would like to share what she said, because I think it's very important. So,
as you said, Thais, domestic violence is a factor of migration, and many women now are leaving their homes because they live with their aggressors. So we have to pay attention about this specific issue. My other question is, migration policies change in these times of COVID-19, but according with BBC News, migration continues and migrants are dying to get home. How can governments, in your opinion, prevent these problems happen? Amanda, can you start?
So when you talk about, sorry, I'm just asking for clarity about the question, dying to get home, as in to leave their host country and return to their home country.
Yes.
I mean, the obvious way to deal with it is simply, repatriation of some sort. And that could mean that, states work out sort of bilateral agreements with individual countries as to how they're going to safely repatriate certain populations, whether they are, going to and on what terms they're going to. Now, there's no sort of international level solution to that kind of movement, or return migration, or repatriation of migrants. Every country is dealing with it differently, and every country oftentimes has to deal with it differently depending on the nation from which these migrants are coming. Again, I'll use the country that I'm currently living in as a sort of, a case example. Qatar has, 85% of its population is migrant labor. Expatriate sort of high skilled labor, and a lot of low skilled labor. And so one of the problems that the country has faced has been this question of repatriation. Mass unemployment was a sort of inevitable consequence of COVID, and lots of migrant populations lost their jobs and had to leave the country. Now, the problem was for some of them that their countries of origin didn't want them back or wouldn't let them return to the country. They had sort of closed their borders, even sometimes to their own citizens. So you've seen in the case of, migrants in the Gulf, or, in Qatar in specific, that there's been a real, not any kind of uniform policy when it comes to repatriating. Some countries have worked out agreements, other countries have not. And it depends a lot on, the context of really of the home country, whether they're willing to accept, or whether they're willing, whether they're not, and who's going to shoulder the cost of repatriating mass numbers of people.
Thais?
Close its borders. And we are facing huge problems with repatriation. We had an issue at the airport last week. But one of the issue we have in the beginning when the law was approved, it was only restricted overland and to Venezuelan nationals. So it was kind of how can I say that? Some people thought it was kind of xenophobic. So but now it's restricted. It's completely restricted. But due to health issues, due to the pandemic and everything. But so we have families that are separated from their families, like people who are separated, especially families from the Latin America. And I don't know, but one thing I would like to bring to the debate is that I don't know if, especially in some governments, if the pandemic, like, because I don't know if now it's necessary to close the borders due to health issues. But if it's gonna be permanent after the pandemic, it's gonna be like something that it will stay, because now we have the law, and then it will stay after the pandemic because it works now, and that's okay. I don't know if it's gonna be like that, because and then that will hugely affect the lives of the refugees and their families. We have at Caritas every week we are distributing food, and we are attending the public, some refugees, and they are always saying what they are demanding, what they are needing, and everything. And a lot of them, they are willing to meet their families again, or to bring their families to Brazil and everything. And how can I say is not now. You can do that now. Like, you have to wait the coronavirus like stop, and then we can see what we can do. So and I'm really worried what will happen after the pandemic, because I don't know what the government all over the world will do, because I don't know if it's that will structure a policy that it's being held over the years, and now with the pandemic it was released to be okay, now you can do that. So I don't know. I'm really worried about it, actually. So
Great points. Uh, Now I want to know about this topic. Migrants in Brazil and in the United States face different scenarios during the pandemic. I would like to hear from you what vision you have about the access of health that migrants have where you live. Also, how unemployment affected them during the pandemic. Amanda, if you can share your experience also in United States and in Qatar, it would be great.
Sure. Yeah. So my answer about the United States again comes purely from an outsider's perspective looking in. Of course, I follow what's happening there, but not maybe as closely as I follow what's happening in Qatar. I mean, the United States has mass unemployment. At this, this is not news. Employment on the level of sort of the Great Depression era. So it's really, really shocking, the numbers of people who are unemployed. And when you're talking about migrants, when you're talking about immigrants, and in the context specifically of the United States, where you have about 11 million undocumented migrants, so people without papers, who by necessity have to work under the table, they have to sort of work in the shadow economy. They are absolutely the most vulnerable segment of the population, migrant or not. So you have already a sort of vulnerable demographic in the United States, and this is being exacerbated by mass unemployment. You asked specifically about sort of access to healthcare and what that looks like in the case of the United States. For undocumented migrants, this is probably the most important issue, not only for the migrants themselves, but also from a sort of public health perspective. If you look at a nation's public health as dependent really on the health of every individual, the more people you have locked out of the healthcare system, the more vulnerable the whole country is, and that's very much the case in the United States. You have segments of the population that simply cannot access healthcare. They risk being deported if they show themselves at a hospital, or come in without papers. And so for them, the incentive is very much not to make themselves visible to the institutions of the state. And so that's not only an economic crisis that's sort of happening, but it's also a health crisis. In the case of Qatar, it's slightly different. You don't have the same level of, sort of undocumented illegal migrants in this case, but you do have a massive, like I said, a massive migrant population here in Qatar. And one of probably the biggest criticisms of the migrant population in terms of, accessing healthcare here has been the sort of company-sponsored, state-sanctioned physical segregation of different populations. So you have, an industrial zone here, which exclusively houses migrant laborers, and not necessarily in the most, healthy and conducive to social distancing conditions you can imagine. So some of the most, the earliest and sort of the most virulent spread of COVID was happening in these migrant labor camps. And access to healthcare, comparatively speaking, is good, because they do in fact have access to healthcare and to doctors at a relatively high level. And some people say that's contributed to the relatively low death rate. But the vector of disease spread is also in a sense a function of what living conditions look like for this particular migrant population.
Thank you.
Okay. So I think that in Brazil they have, as I said before, they have quite a good access to public policies, especially now health policies, like they have access to the unified health system, that is SUS. And they are having access to the emergency aid that the government provided, that it's 600 reais, that it's approximately, $150, that the government provided. But some refugees, they are not being able to register in that aid, because they don't have the documents and all the papers and everything. And you have to have the CPF number, that is the social security number in Brazil. So you have to be a registered refugee with all the documents and everything. So we have some refugees that just arrived in Brazil before the pandemic started. and they are not being able to get the aid and the emergency aid and Bolsa Familia and everything. But they can have to the health system. They all can get at, they all can access. That is not a problem at all. Because but as I said before, SUS is wrecked, so it's overcrowded. So you especially now with the COVID-19. So we have refugees that came for us with special health issues. Oh, I need to do a surgery because I have I don't know, a certain problem, and we said you have to wait for coronavirus to pass because there's nothing to do right now. But we had some that when that had surgeries for at SUS and were well supported and everything, and that was okay. Yeah, I think we that's, I said before a little things about that. I think we have the policies, but they are overcrowded and wrecked, like, as well for Brazilians, and so they face the same problems as Brazilians face. But and the other things, I think that we still have a little bit, I don't know, I think Brazilians embrace a lot of refugees in Brazil, like as I said before, in the case of refugee camps, like they live in urban areas, they live in the same places as Brazilian people, but places that we have problems as well. So again, they face the same problems as Brazilian population. We have the language barrier, but we have a lot of NGOs across Brazil that teach Portuguese to them, and I don't know. I think we have a lot of. But speaking about the government, I think they could do more. But we have the special thing that is health and education they provide, and we have the law that it's very important for them, and I think that's a huge beginning, and I think that's very good.
Thank you for sharing these differences between countries to face the coronavirus crisis. Now I will open the questions to the public. If you have any question, please comment on the chat, and because I will read it and they will answer your questions. And while you writing your question, I will ask one more question to the speakers. Thais and Amanda, I would like to ask you personal questions. How and when did you become interested in migration issues, and why this topic is important to you?
Immigration.
Sorry, I thought Thais was gonna talk. I'll just say, I mean, very quickly, I think I've always been interested in migration. You know, being from a relatively young age, a migrant myself made me interested in the process, right? From a, sort of a personal experience perspective. And it naturally led itself to ask these questions as an academic, from a policy perspective, from a political and economic and institutional perspective. So it was, a sort of a personal connection to the process of migration that led me to, want to study it from a, from an academic perspective.
So my thing was started with the Palestinian refugees, actually. I was still a journalism student in 2013, 14. I started working at the United Nations Information Center in Brazil, in Rio. And I felt very bothered about how the media was dealing with the Gaza war. So I felt I had to go myself to a refugee camp and see myself how was their reality, and write myself reportage and an article, record the video and everything to show their reality, because I think that they are not objects, they are not numbers. I think that's it. And the media, the mainstream media retracts them as they are only numbers of people who are dying in a war, numbers of people who are running for a war, and things like that. And I think they are much more than that. They are people with stories, with families, and with a lot of potential to do amazing things, like people just like us. So I thought, no, I have to go there, I have to do something, and I have to just see myself with my own eyes, and be there and do something. And I don't know, to immerse in their reality, and to understand. I think that was the thing, to understand. And then that was in 2014. Then in 2016 I went to Palestine, and after that I became a great activist on the Palestinian cause. But I also in all the refugees and migrant cause as well. I did an intern at CONARI as well, and for UNHCR and other things. And now I am at Caritas, and I'm really glad to be here as well, because I like a lot the theme.
Now we are arriving to the end of the live stream. I would like to thank you for for sharing your experience, professional and personal experience. Also for your time to be here, and thank you a lot. And please, people, donate to Caritas.
Please.
The link is on the screen, and you can find on the bio of this video. Thank you a lot, Amanda and